Yesterday you chaired a very interesting session on targeted therapies, personalized medicine, myth or
reality.
Can you tell us a little bit about it?
Well, yes, this was actually a title proposed by the Emerging Country Committee, that is a committee of ESMO, constituted by members, colleagues from different parts of the world. And the objective of this committee is to introduce to ESMO to needs and situations that are facing our colleagues in different parts of the world. So one of the challenges today is the issue of the high-cost medicines, the so-called targeted therapies or personalized medicine, and if there is really a possibility for countries that are from low or middle resources or in underserved environments to afford this type of medicines. That was the reason for this. And actually it was a very interesting meeting. I gave at the beginning an overview of the situation from a global perspective. And one of the things that it is important to know is that today's available knowledge about cancer only applies to 10% of the world population. So frequently it is really more necessary to use and to expand and to apply the existing knowledge, not only to achieve new knowledge that sometimes is very difficult to implement. That was one of the core concepts. The other concept that I think it is important to share is that from the total GDP of the world, 10% is allocated today for health. So each $10 that the world is producing, $1 goes to health. And that equation is actually very bad. It is necessary to have health systems more efficient and also to provide to the people, not only to the patients. The ideal view of medicine for the future is a medicine for the health, not a medicine for the sick. That was my first, a very short summary of my presentation. And then the second presentation was Dr. Fortunato Ciardello from Italy. He's a member of the board of ESMO, and he did a very good description of efforts all over Europe in order to implement personalized medicine, but the problems with the laboratory tests, the costs, the need of really an organized system based in the health systems and the governments. And he gave the example of France. France covers all the treatments, and that is a decision of the French government, but they are collecting the data. So in a given period of time, they will evaluate the results of such treatments and perhaps take a decision about which is really efficient and which treatment should not be covered by the healthcare system. And then the third intervention was actually Dr. Ian Tannock from Canada. He's an outstanding researcher, and the title was Research, Funding and Personalized Medicine. Are we in the right way, or we need to redefine the strategy? And actually he was very challenging because he mentioned that there is no evidence in the world that actually these new type of therapies have a very important impact in curability or in long survivals. So actually his position was that today, until today, the role and the use of personalized medicine is more in the field of research or in the field of very, very developed cancer institutes around the world, not to be used in a general way to the general population, but common practitioners. I know that this is a point of discussion, but it is, I think, positive to put this over the table, and each country, each government, each healthcare system, each person can make an informed decision about this. And then the next one was the presentation of Jan Magrath from the International Network of Cancer Research and Treatment, but I think that Dr. Magrath will be giving also an interview, so I think that I prefer to refer the interested persons to his direct presentation. And the last one, it was a very nice presentation from Dr. Ahmed El-Sawi. He's the president of Aortic. He's a medical oncologist from Egypt, and now Aortic is the African Organization for Research and Treatment of Cancer. It's practically today, I think, the only really very operative organization for cancer treatment in Africa. And his position is very clear. He wants to promote access to treatments, but for treatments that are cost effective, for treatments that really have an added value for the person or for his or her disease, not only to have a generalized coverage of medicine that perhaps are really not making a substantial improvement for cancer care. So his presentation was also very attractive for the audience, and there were also some important comments from the audience. One of the participants was Dr. Peter Yu, the president of the American Society of Clinical Oncology, and he mentioned the role of education and the role of information and the collaboration between the scientific societies in different parts of the world.
I think this is a very important point, because the forecast is an explosion of oncology in developing countries. So how are we going to educate the locally people to treat better cancer?
Well, it is important to know that diagnosis and treatment is a small part of cancer control. One important part is human development. For example, in one of our studies published in, I think, Lancet Oncology, I don't remember, we found in Latin America a very close relationship between the GDP of the countries and breast cancer. When you have higher GDP, you have more breast cancer, of course, early stage, and lower mortality and more curability. This is, well, but economy, GDP is part of human development. It is also interesting to mention that, for example, ladies with university careers or with a better education level, they have less breast cancer or more early stages and more curability. So cancer is related with education, cancer is strongly related with economical parameters, but this is not only for diseases. I showed one of my slides, the survival for the Titanic according to the classes. The first class survival after the Titanic sink was 60-something%, 40-something% in second class, 28% in third class. This means that economy and development is related with everything for our survival, not only health and diseases. And that is something very bad. The idea is that the right of a person, because health is a human right, the right of health and cancer care should not be related with the place or the country in which she or he is living. It's a human right, and we need to push the civil society and the governments in order to have equal rights for all persons in the world in order to have the proper access to good cancer care. And that is a statement that was very clearly defined by John Sefrin, the CEO of the American Cancer Society, several times.